Hello, good morning once again mga kaibigan, mga kababayan sa Pilipinas. Si Dr. Latuno again, nagbablog. Ngayon, ang aking topic ay gonna be arthritis. Unang part na to ay itatagalog ko and yung second part would be in English since majority ng aking mga subscriber ay mga Pilipino na galing Pilipinas. So mabuhay ang Pilipinas! Again, itatry ko na i-vlog dito sa Tagalog pero again, mahihirapan ako sa mga medical term kasi karamihan ng mga medical term minsan walang Tagalog equivalent. Again, yung topic ko will be hindi comprehensive. Limit ko lang itong arthritis sa osteoarthritis, sa gouty arthritis, septic arthritis. Meron pang mga ibang arthritis, lalo na yung rheumatoid arthritis, pero baka i-vlog ko na lang yung separately kasi mahabang topic yan. Ang number one is osteoarthritis, ang pinaka-common, pero ito sa mga edad ng 50 years old and above. Ang common na simptoma ay siyempre masakit yung kasukasuan, balakang, sometimes namamaga at naninigas. Ang usually na joint na affected ay yung tuhod, yung balakang, ang mga daliri at paa, tsaka minsan yung spine. To diagnose nito is usually yung simptoma tsaka X-ray, CAT scan or MRI. Ang gamutan dito usually conservative muna, kagaya ng exercise, mga braces, or kung mataba ka, kailangan ko mag-lose weight, lalo na kung may arthritis ka sa tuhod. Pwede rin mga walking aid like cane or walker. Pag hindi yun effective, then kailangan yun ng gamot. Ang unang gamot na ginagamit namin ay yung oral or topical NSAIDs katulad ng naproxen or ibuprofen. Ang naproxen usually 500 mg twice a day as needed pag masakit yung joint. At ang ibuprofen naman 600 to 800 3 times a day as needed din. Pero kung gagamit kayo ng long-term na NSAIDs na tinatawag yung naproxen or ibuprofen, kailangan nyo mag-minom ng PPI kagaya ng omeprazole or tawag nito Nexium. Ang mga NSAID ay contraindicated, bawal sa mga may kidney failure, heart failure, or may hypertension kasi nagkokosto ng swelling at fluid retention. Kung hindi naman nyo kaya yung minom ng NSAID, pwede ring topical na capsaicin or pwede ring salompas. Or kung hindi rin pwede yan, pwede kayong mag-Cymbalta, yung duloxetine. Starting dose of 30 mg once a day, tapos pwedeng i-max dose after 1 to 2 weeks to 60 mg once a day. Ang ina-avoid namin yung mga narcotic kagaya ng Norco, Vicodin kasi may addicting potential. Hindi na masyadong ginagamit yung Tylenol kasi wala naman tong anti-inflammatory properties. Yung ibang gamutan sa arthritis is acupuncture, TENS unit, o yung pangatlo yung PRP, yung platelet-rich plasma. Ito ay ini-inject diretso sa kasukasuan, sa joint. Usually may delayed effect ito ng 2 weeks up to 2 months. Ito na-experience ko na sa aking left knee at effective naman kasi nung in-injectionan ako ng PRP, yung platelet-rich plasma, after 2 weeks nawala yung sakit ko sa tuhod. At ang pang-apat, olive oil. Ang olive oil kasi mayroong ingredient na oleocanthal na tinatawag. Similar ang effect nito sa ibuprofen. Ang pag-inom nito is 2 tablespoonful up to 3 once a day. Pero kailangan uminom kayo ng either tubig, gatas, or juice, or kape para hindi nyo malasahan yung bitter taste ng olive oil. Tsaka ang olive oil is available din sa soft gel capsule. Pwedeng inumin 1 to 2 capsule once a day. Ang pangalawang major arthritis, yung tinatawag na Gouty arthritis. Ito naman due to sa uric acid, mataas ang uric acid sa dugo. Ang simptoma nito, of course, masakit yung kasukasuan, namamaga, namumula, tsaka minsan may lagnat, low-grade fever yung pasyente. Ang usually na apektuhan na joint yung big toe, yung knee, yung elbow, at fingers. To diagnose nito, of course, yung mataas yung uric acid, tsaka may history sa pamilya. Pero kung merong swelling sa joint, pwedeng i-aspirate yung joint fluid para makita yung uric acid crystal sa microscope. Ang gamutan nito, una-una ginagamit yung oral steroid, prednisone, usually 30 mg up to 40 mg once a day for 7 days. Yung iba tinitaper off for 1 to 2 weeks. Tapos kung ayaw nyo ng steroid, pwede ring NSAID ulit, yung naproxen, 500 mg twice a day, or indomethacin, 50 mg 3 times a day as needed. Again, contraindicated to sa mga may kidney problem, liver problem, or heart failure. So kung hindi nyo matolerate yung dalawa na yun, pwede rin colchicine, 1.2 mg ang initial dose, and then 0.6 mg after 1 hour. And then daily hanggang mawala yung pananakit sa kasukasuan. Pero ito bawal din sa may kidney at liver problem. Pangapat, pwede ring IV steroid injection sa may gout. Ang mga pagkain na kailangan iwasan sa may gout ay tinatawag yung high purine diet. Kailangan nyo ng low purine, bawal ang mga karneng baka, mga internal organ, kagaya ng atay, kidney, intestine. Bawal din ang alcohol, mga matatamis na pagkain. Bawal ang sardinas, tuna, trout, lobster, tsaka shrimp. At yung pangatlong arthritis, tinatawag na septic arthritis. Ito yung infection sa mga kasukasuan. Usually nanggagaling sa ibang parte ng katawan, or kung meron kang knee or hip replacement, yung prosthesis na tinatawag, sometimes na-infect ito. Ang most common bacteria na nagkakos nito ay Staph aureus or streptococci. Ang simptoma again is isang namabagang kasukasuan kagaya ng knee, swollen, mapula, masakit, tsaka usually may lagnat ang pasyente. Pero other joints na pwedeng maapektuhan ng septic arthritis, pwedeng ankle, pwedeng wrist, pwedeng hip. Ang gamutan nito ay kailangan ng orthopedic para i-debride tsaka drain. Pero yung arthrosynthesis, ang kailangan din to diagnose, kukuha ng sample ng fluid dun sa joint na affected. Tapos ipapadala for analysis, usually gram stain culture kung negative yun. Pero yung white count is greater than 20,000, ito ay already most likely septic arthritis. So ang kailangan nito ay antibiotic. Ang usually ginagamit namin ay vancomycin, or pwede ring Rocepin kung hindi MRSA. Pero kung ang lumabas sa culture ay Pseudomonas, kailangan yung Cefepime or Ceftazidime. At usually ang gamutan nito ay up to 4 weeks ng IV antibiotics. Alright. Tapos na ang aking Tagalog part, now English part. Again, the most common type of arthritis, osteoarthritis. I'm also going to discuss gouty arthritis and septic arthritis. Osteoarthritis is common age 50 and above, and the most common symptoms are joint pain, swelling, stiffness. Joints that are most commonly affected are the knee, hip, fingers, feet, and spine. And to diagnose it based on the history plus X-ray, CAT scan, or MRI. And the initial treatment is usually conservative treatment like exercise to lose weight, braces, or walking aid. But if the conservative treatment failed, then you need to use drugs. Usually we start with oral or topical NSAIDs like naproxen, 500 milligram twice a day, or ibuprofen, 600 to 800 3 times a day as needed. But if you're going to take a long-term NSAID, you better take also PPI like Prilosec, Nexium, or Protonix to prevent you from getting ulcer in the stomach. And if that doesn't work, you can use topical capsaicin or even Salonpas. And if you don't want to use NSAID, you can use Cymbalta or Duloxetine, 30 milligram once a day, and then after 1 to 2 weeks, you can increase the dose to 60 milligram. Remember, NSAIDs are contraindicated if you have kidney failure, heart failure, or hypertension. And we usually avoid narcotics for arthritis since it's highly addicting, like Vicodin, Percocet, Norco. Okay, there are other treatment for osteoarthritis like acupuncture, TENS unit. And one that I had is PRP, which is platelet-rich plasma. This injected directly to your joint. Usually they use a centrifuge. They get blood from you, and then they separate the red blood cells and let the platelet with the plasma remain, and they inject it to the joint. Usually the action is delayed about, in my experience, 2 weeks to 2 months, but it works. My pain in my left knee went away. And if you don't want that, you can try olive oil. Olive oil has an ingredient called oleocanthal, which has similar properties to ibuprofen. The way to take it is 2 to 3 tablespoonfuls once a day. Also has a delayed effect. This one mostly up to 6 months delayed effect. But it works and it's natural, and you have to take or drink water, any beverages after drinking olive oil because it has a bitter taste. Number 2 arthritis is gouty arthritis, usually secondary to hyperuricemia, high uric acid in the blood. It presents severe pain, swelling, stiffness, and sometimes a patient can have low-grade fever. The most commonly affected joints are the big toe, the knee, elbow, and fingers. To diagnose gout properly, you need to get a sample of fluid from the affected joint and send it for analysis. Usually you will see uric acid crystals under the microscope. Treatment for gouty arthritis, usually you can start with steroid prednisone, oral prednisone, 30 to 40 milligram once a day, and some doctors will taper it. And then number 2 is NSAID, again naproxen, 500 twice a day, or indomethacin, 50 milligram 3 times a day as needed. Again, this is contraindicated if you have kidney, heart problem, or you have history of GI bleeding. And if you don't like NSAID, you can start with colchicine, 1.2 milligram first dose, and then 0.6 milligram 1 hour after, and then daily until the flare-up goes away. But colchicine is also avoided in renal or if you have liver problem. Another treatment is IV steroid in the joint for acute gouty arthritis if the pain is severe. For gout, you have to avoid certain food. You have to have a low purine diet, and the food you need to avoid are red meat, internal organs. You need to avoid alcohols, sweets, sardine, trout, tuna, and lobster and shrimp. And then the third major arthritis called septic arthritis. Usually this infected joint coming either hematogenously coming from others, infection in the part of your body, or if you have a prosthesis like knee or hip prosthesis, this sometimes can be infected, cause septic arthritis. And the most common bacteria usually, of course, Staph aureus and streptococci. And then you'll notice you have a single painful swollen joint, and that's also red and warm to touch, and patients usually have fever. And the other affected joints are the wrist, ankle, and of course, hip. And to diagnose this, you need arthrocentesis, where you aspirate the fluid in the affected joint and send for analysis. You do gram stain culture, and that's negative. Then you rely on the white count on the fluid. Usually, if it is greater than 20,000, then it is a presumptive diagnosis of septic arthritis. And treatment is you need the orthopedic to drain and sometimes debride the joint. But you will need IV antibiotics. Usually we start with IV vancomycin or Rocepin for 4 weeks. And if it is the culture grows Pseudomonas, you can use Cepifim or Ceftazidime also for 4 weeks. All right. Again, thanks so much for listening to my blog regarding arthritis. I hope you have a good day. And also remember, my topic are not comprehensive. I only give the most common one. And again, at the end of this blog, I have to present you my disclaimer. Again, to my Filipino subscriber, thank you so much for subscribing. Again, subscribe and like, and continue listening to my channel about medical issue. I hope you learned something from this. God bless you, and mabuhay sa mga Filipino subscriber ko. All right. Peace out.